Hi, my name is Jonathan and I have hypertension and suffered from a heart attack. After my nurse practitioner prescribed me a beta blocker, I was able to get back to living my life.
Beta blockers, also known as beta adrenergic agonists, are used in the treatment of cardiovascular disorders such as heart failure, asymptomatic left ventricular dysfunction, and after an acute MI. They are also useful in tremor, migraines, and headaches, and glaucoma. They can relieve symptoms such as palpitations, tachycardia, tremors, anxiety, and heat intolerance for patients with hyperthyroidism. Drugs in this class include acetylol, atenolol, metoprolol, Nadol, Nebivolol, Pendolol, propranolol, timolol, betaxolol, cartelol, levobunol, metopropranolol, timolol, and labetalol. They act by occupying the beta receptor sites and prevent binding by catecholamines and other beta agonists. They block both beta 1 and beta 2 receptor sites, so norepinephrine and epinephrine cannot bind to the beta receptor sites. Beta blockers reduce blood pressure by reducing peripheral resistance. In glaucoma, beta blockers can be used to decrease intraocular pressure by decreasing production of the aqueous humor. Beta blockers are well absorbed in the gut when given orally. They are widely distributed in the body tissues. They cross the placenta and enter the breast milk. Most beta blockers are metabolized extensively by the liver and excreted via the bile, feces, and urine. Beta blockers are contraindicated in patients with asthma and patients with AV block. Patients with heart failure may use beta blockers with caution. Older adults may use these medications in lower doses and with special attention to cardiac and renal status, and should only be used in situations where there is more than one indication for use. Beta blockers mask common symptoms of hypoglycemia in patients with diabetes and should be used cautiously. Since all beta blockers pass through the placenta and breast milk, they should only be given to pregnant or nursing mothers when benefits clearly outweigh the risk. Adverse drug reactions include bradycardia, congestive heart failure, hypotension, fatigue, weakness, dizziness, anxiety, depression, drowsiness, insomnia, nightmares, hyperglycemia or hypoglycemia. Dry mouth is uncommon but may occur. Changes in GI motility may result in anorexia, nausea, vomiting, flatulence, and constipation or diarrhea. Can cause decreased libido, can cause bronchospasms, and should not be used in patients with asthma. Less common reactions include muscle joint pain, pruritic rashes, and facial swelling. Hypotension may occur, so stand up slowly from a seated position. Don't exercise in hot weather, and make sure to stay hydrated with non-caffeinated fluids. Beta blockers have drug interactions with aluminum salts, barbiturates, calcium salts, chlorhistamine, NSAIDs, ampicillin, rifampin, calcium channel blockers, Cipro, digoxin, antihypertensive, alcohol, nitrates, amphetamines, proazoans, sulfonylureas, and clonidine. Be sure to monitor for the drug's effect. Have a blood pressure cuff at home to be able to closely monitor your blood pressure and monitor to ensure angina attacks are becoming less frequent. Take the medication exactly as prescribed. Do not skip or double doses. Do not abruptly stop a beta blocker as it may cause life-threatening arrhythmias, hypertension, and myocardial ischemia. Make sure you always have enough of your medication. Always take beta blockers with either food or on an empty stomach. Either is appropriate. You just must be consistent. Talk with your doctor before taking any over-the-counter cold medications as there may be a drug interaction. Hi, my name is Natalie and I'm Jonathan's nurse practitioner. Here are some main takeaways for you about beta blockers. Number 1, prescribers. Remember to prescribe in caution with patients who have asthma, as beta blockers may worsen their asthma. Beta blockers cause vasoconstrictions of the lung. If a beta blocker is absolutely indicated, make sure to prescribe a cardioselective beta blocker. Number 2, if beta blocker is being used for hypertension, other lifestyle changes can be made as well, such as weight loss, low sodium diet, stopping smoking, limiting alcohol, performing regular exercise, and managing stress. Number 3, if you are a diabetic and notice excessive sweating, make sure to check your blood sugar. Sweating is the only symptom of hypoglycemia that is not masked by a beta blocker. And lastly, remember that all beta blockers end in LOL, so they're easy to identify whenever patients give you a list of their prescription medications that they are taking.